Welcome back to our channel. Today we're diving into a topic that might surprise you, how your feet can reveal hidden liver problems. You know I'm all about empowering you guys with knowledge about your health, and sometimes the answers can be found in the most unexpected places. We often talk about symptoms we can feel, but what about the signs we can see? Specifically, what can our feet tell us about the health of our liver? Let's break it down. All right, let's talk about swollen feet. We've all experienced it at some point, right? It's a common occurrence, especially after a long day of being on our feet. Maybe after a long day of walking or standing, your feet just feel a little puffy. You take off your shoes, and there they are, slightly swollen. That's normal, that's just fluid temporarily pooling due to gravity. Elevating your feet can help reduce this swelling. But what if the swelling is persistent? What if it doesn't go away after a good night's rest, or after elevating your feet? What if it's not just your feet, but also your ankles, and it just doesn't seem to go away? This could be more than just a temporary issue. This, my friends, could be a sign of a bigger issue, potentially a liver issue. Persistent swelling can be a red flag. See, our liver plays a crucial role in regulating fluid balance in the body. It's responsible for many vital functions, including detoxification and protein synthesis. When the liver isn't functioning optimally, it can lead to a buildup of fluid, a condition known as edema. This is when excess fluid gets trapped in your body's tissues. This fluid retention often shows up in the lower extremities first, like our feet and ankles. It's one of the most noticeable signs. Now, I'm not saying that every time you have swollen feet, it's a liver problem. There are many reasons why your feet might swell. That's definitely not the case. It could be something as simple as standing for too long or even dietary factors. But if you notice persistent, unexplained swelling, especially if it's accompanied by other symptoms we'll be talking about, it's crucial that you get it checked out by a healthcare professional. Don't ignore persistent swelling. It's your body's way of trying to tell you something's up, and it's always better to be safe than sorry. Listening to your body can prevent more serious health issues down the line. Early detection is key when it comes to any health concern, and liver health is no exception. The sooner you catch a potential issue, the better your chances of managing it effectively. Think of your body like a car. Just like a car needs regular maintenance, so does your body. If your car's check engine light came on, you wouldn't just ignore it, right? You'd take it to a mechanic to get it checked out. Similarly, think of persistent swelling as your body's check engine light, a signal to get things checked. It might be nothing serious, but it could be a sign of something that needs attention. Remember, knowledge is power. Being informed about your health can make all the difference. It might be nothing serious, but it could be a sign of something that needs attention. Remember, knowledge is power. By understanding the potential link between swollen feet and liver health, you're empowered to take charge of your well-being. By understanding the potential link between swollen feet and liver health, you're empowered to take charge of your well-being. So, keep an eye on your body's signals and don't hesitate to seek medical advice when something feels off. Your health is worth it. Now let's move on to another foot-related sign that could indicate a liver issue: itchy feet. This might sound surprising, but our feet can tell us a lot about our internal health. We've all experienced itchy feet at some point, right? It's a common annoyance that most of us have dealt with. Maybe you blame it on dry skin or athlete's foot, and often that's exactly what it is. Dry skin can be caused by a variety of factors, including weather changes, dehydration, or even the type of soap you use. But what if the itching is persistent, intense, and just won't quit, especially on the soles of your feet? This kind of itching can be more than just a minor irritation. This, my friends, could be another sign that your liver is struggling. When the liver isn't working as it should, it can lead to a buildup of toxins in the body. One of the liver's many jobs is to filter out waste products from our blood, and when it's not functioning properly, these waste products, including something called bilirubin, can build up in the body. Bilirubin is a yellow compound that occurs in the normal catabolic pathway that breaks down heme in red blood cells. This buildup of bilirubin can cause intense itching, and it often manifests in the extremities, like our hands and feet. The itching can be so severe that it disrupts daily activities and sleep. So if you're experiencing persistent, unexplained itchy feet, especially if it's accompanied by other symptoms like jaundice, fatigue, or abdominal pain, It's essential to consult a healthcare professional. Early diagnosis and treatment can make a significant difference. Now, I know what you might be thinking. Dr. Mike, you're making me paranoid. It's easy to jump to conclusions when we hear about symptoms and their potential causes. Every itch, every ache, now I'm thinking it's my liver. It's natural to be concerned, but it's also important to stay calm and rational. And listen, I get it. I don't want you to panic over every little thing. Our bodies can exhibit symptoms for a variety of reasons, many of which are benign. But here's the thing. Our bodies are incredibly complex and interconnected. What happens in one part of our body can often manifest in seemingly unrelated areas. This interconnectedness is what makes diagnosing health issues both challenging and fascinating. What happens in one part of our body can often manifest in seemingly unrelated areas. For instance, liver issues can cause symptoms in the skin, digestive system, and even mental health. Our feet, believe it or not, can offer valuable insights into our overall health, including the health of our liver. So, pay attention to what your feet are telling you, and don't hesitate to seek medical advice if something feels off. Let's talk toenails, shall we? These small, often overlooked parts of our body can actually reveal a lot about our overall health. Specifically, changes in toenail color. It's not just about aesthetics, it's about what your body might be trying to tell you. We all know that our nails can tell us a lot about our health, right? Brittle nails, spoon-shaped nails, ridges and discolorations, they can all be indicators of underlying deficiencies or conditions. For instance, brittle nails might suggest a lack of essential vitamins or minerals. But did you know that the color of your toenails, specifically a yellowish discoloration, can sometimes be a sign of a liver issue? Yes, that's right. Jaundice, a condition that causes a yellowing of the skin and eyes, is often a telltale sign of liver dysfunction. And guess what? This yellowing can extend to your nails as well. It can also show up in our nails. So, if you notice that your toenails are looking a little yellow, a little pale, or even white, don't just brush it off. It could be nothing, maybe a fungal infection, which is quite common and treatable. But it could also be a sign of something more serious, like jaundice related to liver problems. Ignoring these signs could lead to more severe health issues down the line. It's always best to err on the side of caution and get it checked out by a healthcare professional. They can provide a proper diagnosis. It's always better to be safe than sorry. A healthcare professional can run some tests, determine the underlying cause, and recommend the appropriate course of action. This might include blood tests, liver function tests, or even a biopsy if necessary. They will guide you through the process and ensure you get the right treatment. Remember, early detection is key, so keep an eye on your toenails. They might just be the early warning system your body needs to stay healthy and happy. Let's talk about foot pain. We all experience it from time to time, right? Maybe you wore the wrong shoes. Maybe you walked a bit too much. But what about persistent, unexplained foot pain? Could it be related to your liver? It's possible, and here's why. Our liver plays a crucial role in producing proteins that are essential for blood clotting. When the liver isn't functioning properly, it can lead to a decrease in these clotting factors, which can result in easy bruising and bleeding. This bleeding can occur anywhere in the body, including our joints. And guess what? Our feet have a lot of joints. So if you're experiencing chronic unexplained foot pain, especially if it's accompanied by easy bruising or other symptoms we've discussed, it's essential to consult a healthcare professional. They can assess your symptoms, run some tests, and determine if there's an underlying liver issue that needs to be addressed. Let's talk about skin changes, specifically red or brown spots on the feet. Now, we all get spots, right? Maybe it's a freckle, maybe it's a mole, maybe it's just a random blemish. But what if you notice unusual spots, particularly red or brown ones, on your feet? Could this be related to your liver? Believe it or not, it's possible. Our liver plays a vital role in detoxifying our body, and when it's not functioning optimally, toxins can build up and manifest in various ways, including skin changes. These red or brown spots could be a sign of liver spots, also known as age spots, which are harmless but can indicate liver stress. They could also be a sign of other liver-related skin conditions. So if you notice unusual spots on your feet, especially if they're accompanied by other symptoms we've discussed, it's always best to err on the side of caution and consult a healthcare professional. Thanks for watching. If you found this video helpful, don't forget to like, share and subscribe for more health tips. And remember, your feet can tell you a lot about your overall health, so pay attention to the signs. We've covered a lot of ground today, from swollen feet to itchy soles to discolored toenails. It's amazing how interconnected our bodies are, right? If you're experiencing any of the symptoms we've discussed, please don't ignore them. Early detection is key when it comes to any health concern, and liver health is no exception. Schedule a checkup with your doctor to get a proper diagnosis and discuss any concerns you may have.